We've had lots of news about the NHS this week. A&E waits, ambulance response time hitting their worst levels on record. That's according to data released on Thursday. That showed that more than 40% of people needing hospital beds spent more than 4 hours waiting on trolleys. It seems to be in a right old state, doesn't it? Well, plenty of you have joined in discussions about this on our BBC Hereford and Worcester Facebook page this week. The NHS faces a crisis on multiple fronts this winter. Some people are just saying it's broken. The whole system's gone. So perhaps that didn't surprise us then to read a report from the Private Healthcare Information Network. Now, they record number of patients opting to self-pay for procedures. Is that you? Have you decided to go private just to secure yourself? Bit of a safety net rather than wait for the NHS? I'd like to know if you have and what you've made of it. Dr. Ian Gargan is the Chief Executive of the Private Healthcare Information Network. He joins us now. Dr. Ian, good morning.
Good morning, Malcolm. How are you?
Great. Thank you so much for coming on. I think this is really important that we talk about this. Tell us what you do first, though.
So I'm the Chief Executive of the Private Healthcare Information Network, as you mentioned, PHIN. I was previously a psychologist and then an orthopaedic surgeon. I've been working in the public and private sector as a medic for many years now, and joined PHIN this year. And PHIN, as leader of the organisation, we're a data architect. We collect data from over 135 providers across 450 sites in Great Britain and Northern Ireland, and that we're not for profit and we've no commercial axe to grind, and we collect that data and put it on phin.org.uk so that patients, we're all patients, individuals, can look at that data and make informed choices about where they'd like to go to have their procedures and healthcare intervention. So
what are your figures telling you, Dr. Ian?
They're telling us that people are increasingly paying for their own procedures and their surgery. Most common surgery, Malcolm, in the country would be hip replacements, knee replacements, cataracts, scopes for knees, and cardiology and GI procedures. And they're rudimentary procedures in medicine. They'd be pretty straightforward to get done, but the waiting times in the NHS, unfortunately, are too long, and people don't have visibility when they're going to have these operations, so that they're paying for it themselves.
And is this as a reaction to the news we've been getting over the last few months, or is this a general trend?
It's a bit of both. So pre-pandemic, it's up by about 33%, the figures now. In some places in the country, it's up as much as Wales, up by 90% to self-pay. I think the waiting list got so long through the pandemic, Malcolm, that people just have lost patience. And as a result, they're just increasingly finding the money, which must be very stressful, given that we're in a time of economic crisis. We're seeing this trend continually rise, and it's risen since 2019, and it's continuing to do so month on month.
I think we'd all go private if we had the money, but as you say, it's a difficult choice to make at the best of times, set against the backdrop of a cost of living crisis. It's almost totally out of range for many of us, isn't it?
It is, absolutely. And it's important to say the NHS provides amazing care and has the ability to do all these procedures and more sophisticated care, even though the private healthcare sector can do a lot more sophisticated stuff than they used to do in the past. So I think a solution would be a twin track system whereby NHS can take care of some patients and then the private health sector can take care of some as well. But we'd all like to just be able to get our procedure done next week, not have to wait 6 and 9 and 12 months, which is also threatening to our health. But perhaps there's a solution, and the government can help in some way to make it more affordable for people so they don't have to remortgage homes and go through increased stress. I'm a big believer as a doctor that patients, it's tough enough to have intervention to maintain your health, but the experience should not be stressful to do so.
And you do really believe that the two, private and NHS, can work hand in hand if that measure from the government comes into force?
I absolutely believe that. So, as you may tell, I've trained in the Republic of Ireland. I've lived in England and worked with the NHS for years. But in Ireland, we have what's called a National Treatment Purchase Fund, which is effectively a government-funded body for all of the hospitals, private and public hospitals in the country, that if you're on a waiting list for more than 3 months, you immediately qualify to move from a waiting list into the private health network so you can get your operation done. I think a system similar to that placed in the UK might be a good idea.
Of course, there's no option when it comes to ambulances and A&E, is there? We can't book our own private ambulance when we fall ill. We can't book a bed in a private A&E ward.
Correct. So, and that is probably a priority. I would say there's main priorities to be addressed in the healthcare system at the moment. Emergency care and ambulances. If you need an ambulance, you should be able to get one right away and not be waiting hours for one to arrive. It's a threat to life. And secondly, then we should have no waiting lists, and also very mindful of the stress that healthcare assistants, nurses and doctors are under. The working conditions need to improve. So those three areas, but you're completely right, Malcolm. The A&E and the paramedic service need to be supported and helped so that patients don't have to wait to be seen.
I think it's fascinating what you do, and it's really lovely having you on the show today and talking about this. It's a very, very important discussion, I think. Dr. Ian, let's speak again. Thank you for coming on.
Thank you, Malcolm. Pleasure.
That's Dr. Ian Gargan. He's from the Private Healthcare Information Network. They're called PHIN, PHIN. So when he said PHIN, that's them, PHIN. And they're independent, they're not for profit, they just give you the facts so you're able to make an informed decision. Have you made that decision?